Welcome everyone to today's webinar, Why Patient Financial Clearance Must Evolve and How to Do It. On behalf of Becker's Healthcare, welcome and thank you so much for joining us. Before we begin, I will walk through just a few quick housekeeping instructions. If you have any questions throughout today's webinar, feel free to type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Finally, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. At this time, it is my pleasure to introduce today's presenters, Cherie Kane and Paola Turchi. Cherie Kane is a fellow in HFMA and MGMA, and she holds a master's degree in healthcare from Central Michigan University. She is a result-oriented revenue cycle executive performing transformations for some of the largest healthcare systems in the country. Her expertise is in areas such as cash acceleration, patient access, charge capture, billing, follow-up, denials, underpayment recovery, vendor management, and revenue cycle automated intelligence. Paola Turchi is a fellow in HFMA and MGMA and holds a master's degree in healthcare administration from California State University of Long Beach. She has over 20 years of experience in revenue cycle leadership, business process outsourcing management, and process redesign and technology consulting. Paola leads Notable's RCM solutions, concentrating in the optimization and automation of processes that enhance the experience of the patient, the staff, and the providers. Ladies, thank you so much for joining us today. I will now turn the floor over to you.
Thank you so much, Sarah, and thank you everybody for joining today's webinar. So let's go through what we're going to be discussing today. The first thing is we will talk about the patient financial clearance and why this must change. Then we'll move on to improving the patient financial clearance with intelligent automation. And we'll end with best practices for improving this particular process. So Cherie, go ahead and kick us off.
Hey, thank you so much, Paola, for that reviewing the agenda and the introduction. So patient financial clearance must change. We must learn to automate and really reduce the staffing requirements and the error processes that we have. Today, massive staffing shortages. What I'm hearing from my providers that I work with, there's 20 to 30% vacancies in the revenue cycle positions in those departments, patient access from billing, follow-up, all the way through. So these are just causing massive issues for our hospitals. Revenue cycle leaders are managing a variety of expectations from patients, physicians, clinical leaders, along with their hospital executive teams. The hospital executive teams are expecting significant cash, and yet we continue to have these error-prone manual processes. From the patient's perspective, the patients coming in, if they haven't pre-registered, they're going to have a wait time potentially of 10 to 20 minutes going through the process, assuming that the registrar is ready to take them immediately. This is causing significant stress on the patient as they are waiting for a test. Maybe they don't feel well and they're worried about the outcome. How can we innovate and we make registration and financial clearance process easy for the patient and our staff, reducing cost, work effort, and speeding the patient through the process to create a positive customer service experience? These error-prone processes are what needs to be automated, and we need to eliminate these manual processes. And it should be a goal for the hospitals and providers. Once the patients have a positive experience, the patient will be back. If they have a negative experience, they potentially could tell 11 other people how long they waited in patient access. All providers are experiencing increased claim denials. In the past, there were government regulations that required timely payment. To the day, the majority of those health plans are not required to comply because 95% of the payers are self-insured. In 2023, more than 60% of the hospitals are expected to lose money. That is unprecedented. The question is, how do we resolve these challenges and improve the provider experience for our patients and for our employees? As we move to the next slide, leaders are struggling with massive staffing shortages. Let's think about how we can change this process. 90% of the CFOs are stating they're feeling the labor shortages. Hospitals are struggling to find employees to fill these positions. These positions are often the lowest paid and often the most critical positions within the facility. Providers are in competition with Amazon, along with other restaurants. Some are even offering extensive sign-on bonuses to obtain these employees. Once we identify these employees and hire them, then we have a very extensive training and development process that must occur. If the employee comes in from a Walmart or another location where they haven't had any insurance experience, they may have to be trained on Medicare and Medicaid, along with other payers and the complexity of those payers. Not only that, but the vendors that we're using today. Many hospitals have extensive vendors they're using to fill the gaps in the registration process, from address verification, insurance verification. If they don't have an insurance verification process, we may have to train them to use websites, which is also complicated. So once these employees are hired and trained, and the training may take anywhere from a week, 30 days or more, now we have to manage the workload. And these employees are getting burned out. Many of the providers I talk with, the employees are being mandated to work overtime. In lieu of that, they are leaving the organization altogether. So how do we do that? How do we manage this with the workload, the employee burnout, and make it better for our employees? As we move to the next slide, staff are burdened with these error-prone manual processes. So let's do a deep dive and talk for a minute about what these processes look like. Pre-registration, the patient is required to come in. Maybe they are done this on the phone, obtain the demographics, the patient name, along with the insurance information, keying all of this information manually. Sometimes the policy number can be as extensive as 16 digits. Then you move to the insurance verification process. As we discussed earlier, 95% of these employers are self-insured. So the insurance verification process can be extensive from the perspective that I hear from my patient access staffs that there's multiple IDs, icons on these cards. So it's just not one insurance company that they may be dealing with. So they may be contracting with one vendor, one payer for the negotiated rate and for the network, and then someone else to process the claims. So this insurance verification process can be labor intensive. Then we move to the authorization process. In the authorization, if the patient's admitted, they will have to notify the payer the patient's been admitted. Then case management utilization review would be required to send medical records and for those to be authorized for the service. That authorization number then needs to come back to the provider and oftentimes added to the bill or the 837 for payment. Lastly, it's payment collections. Not only does the patient have to be estimated, it's a self-pay patient, it may be require the physician along with the ICD-9 and the service to come up with an estimation of the payment that's going to be required from a self-pay perspective. But then you have the insurance payment. The insurance payment that's expected from the patient is based on the negotiated rate, which is based on the payer. So that is also an extensive process to get that estimation. Oftentimes, the patient does not pay that at the time they are asked. So then it's multiple phone calls and also multiple statements before those payments can be collected, increasing the cost to the provider and the frustration to the patient as they are unable to resolve those payment amounts. And so if we can automate these processes and eliminate all this duplication, it would significantly reduce costs to the hospital, patient frustration, and speed the payment to the hospital. So as we're thinking about the increasing payer complexity, some of the headlines: Medicare Advantage plans denying more inpatient claims. They are adopting more restrictive criteria commonly used in the commercial carriers. Claim rates, denial rates are as high as 80% for some marketplace payers. What we've learned is 40 to 60% of claims are denied because of the initial registration process. Either the policy number is incorrect, the subscriber name is incorrect, the subscriber relationship may be incorrect. All of these cause these claims to be denied. If we could eliminate these errors at the time of registration, pre-registration, authorization, insurance verification, we could substantially increase our cash. Many hospitals are saying that this is a delay tactic, but what it does is it creates labor and cost for the hospitals. As we think about administrative denials, which are due to the demographic information, the hospital must take that claim, research why the claim was denied, correct the claim, and resubmit it. That cost can be $25 to $35, which is extensive, and then also delays the payment. If it's a clinical denial due to authorization, medical necessity, the cost for those claims and fixing those claims is significantly higher. Typically, you have a nurse that requires that you reprocess that claim. They are going to have to research the medical record, write the appeal. You're paying a nurse's salary, and then the cost of the medical records. So the cost of the appeal is hundreds of dollars. Once the payer receives that claim, then it takes months for them to pay the claim or months to deny the claim again, and the hospital is back appealing the claim the second time. We need to reduce the complexity. We need to automate. As we work to make these changes, reduce our denials, and speed our payments to our hospitals. As we're thinking about next steps, Paloa, can you talk about how we can improve this process?
Absolutely, Sherry. So you definitely have laid the ground as to why it's so important for us to evolve the financial experience. I mean, the fact that we have all these shortages, that the staffing members are really struggling with keeping up with the volumes and therefore are causing errors that then affect denials. And the insurance companies continue to be more complex than ever and changing requirements. Automation is definitely the way to go to facilitate this particular process. So if we go to the next slide, we are talking about improving the entire financial clearance process with intelligent automation. Everywhere from demographic verification, so making it easier to obtain this information that is high fidelity, then going through the process of verification of benefits, of eligibility, going through prior authorization in a timely manner, also checking medical necessity, and at the end, closing the loop with estimating the patient out-of-pocket expenses that is transparent to them and helping them through the process of paying for these particular balances or out-of-pocket expenses. But before we move on into the details as to how best practices could be implemented, let's talk about automation for a second. So let's go to the next slide and talk about 4 key components that we see with intelligent automation. The first one has to do with optical character recognition, or OCR. And that is the concept of recognizing and extracting text from insurance card in order to be able to input this information into your EHR. Then we're talking about robotic process automation. So that is the concept of using digital assistants to be able to behave as humans, capture the information that is needed, and enter it into the system. So let's make it a little real with perhaps an insurance card. So we're using OCR technology to extract the information from the insurance card. So we're talking about the subscriber's name, we're talking about the insurance ID, the group number, and so forth. Then we use robotic process automation to take this information and automatically enter it into the EHR by using natural language processing and computer vision. And what I mean by that is that it's extremely important that the tools are able to read the information that is on the screen. So that way, regardless of where these fields might reside in the system, the information can be entered into the EHR. We see, or the practice management system. We see a lot of challenges with bots that are kind of like reading specific location within the screen to be able to enter the information. So I give you an example. Back in the day and still today, you see a lot of technologies that will say, okay, look at the left-hand corner, top corner of the screen to enter the patient's ID. If the image of that particular screen changes, then the bot breaks. So that's why it's so important to use natural language processing and computer vision to be able to put that information into the screen regardless of where it's located. So that way the bots do not break. And of course, NLP and computer vision are part of the machine learning, which really improves the performance of the bot itself. So that's what intelligent automation is all about. Now, let's move on to the next slide. And what we really want to highlight here is the fact that patients and staff members are craving for automation. And what I mean by that is that according to a survey that we had released this year, so Notable State of Automation Report of 2022, we have found that 81% of the patients are hopeful that technology can improve their experience. So patients are really selecting perhaps a health system to go to or a provider to visit based on the type of technology that this provider might be able to offer, or what kind of self-service possibilities do they have with the organization. And then the second part has to do with the fact that because of staff shortages, 48% of healthcare professionals are worried about the ability to hire or retain staff without really using automation. And we're talking about the concept of allowing staff members to work to the top of their license versus working on very mundane and repeatable processes, which is something that automation could address. And it's really delivering a lot of results. So the first part has to do with superior patient outcomes. So we're talking about patient satisfaction, right? So on the lines of 97+% of patient satisfaction is something that we see in the industry today. Also, increased on patient access. So we're talking about closed care gaps to be able to open these opportunities for patients to come in when they need to come in. The other component from an impact of this particular automation is related to increased operational efficiencies. So we're talking about 2x of new appointments now be available, as well as 64% reduction in no-shows. And finally, there is a financial impact when we're talking about implementing automation. For example, is FTE capacity created. So now the team members that are busy doing these mundane, repeatable tasks are freed up and able to do more complex processes that perhaps they don't have time to do in their day-to-day activities. And the second part has to do with reduction of write-offs and increase in revenue. So it's something that is definitely impacting the industry, and we're seeing results. Now, let's talk about best practices. So let's start with the registration process. So if we were to summarize everything, that's where everything starts, right? It's the demographic verification, getting high fidelity data, moving to eligibility, benefit verification, prior auth, and then we were talking about outpatient balances and collections. So this is kind of like the financial clearance process summarized, bringing it back to the picture now that we're going to talk about the details. So let's go to the next slide. And now let's talk about empowering patients to do self-service pre-registration. So let's talk about how it's been in the industry, or what has happened before automation. One is the manual outreach to collect patient information. And sometimes it's not even an outreach. Sometimes organizations are waiting for the patients to show up at the practice and capture the information when they are at the time of visit, in which in some instances it's too late for an authorization, for example, to be obtained, or it will be a surprise for the patient to determine how much they are going to owe if we're waiting until the last minute to collect that information. The second part has to do with patients manually completing pre-registration forms. So I still have a doctor's visits in which I go and I have to sit down in the waiting room and complete these forms manually, although I might have already completed those forms in a previous visit. So it's this repetitive work that we're asking patients to complete. And then the last one has to do with staff reaching out for inaccurate data that has been captured in the past. So the information was not captured correctly to begin with, the claim got denied, and now we have resources in the back end reaching out to the patient to find out if they have an updated address, or to find out if they have a new insurance, a more costly way to collect for those dollars. So what does it look like after? automation? What is it that we are improving? So number one is a streamlined pre-registration process that requires no phone calls. So we're allowing the patients to go through the process of self-registering and enter this information at their convenience, in the comfort of the home, for example. The last thing that you want to do as a mother or as a father is to go to the pediatrician, having 3 kids, they happen to be sick, and having to complete forms manually while we're waiting in the waiting room. The other component has to do with high fidelity data. So we are able, as patients, to be able to see on the screen what is it that we're entering. We're able to identify whether or not our address is correct. And besides that, there are edits and scrubbers in the background that are verifying the information. So once the address is entered, for example, then you have the verification with the US Postal Service to make sure that that address is correct, that we have a matching zip code, for example, or that we're not missing an apartment number. And the second part has to do with insurance verification, right? So if you enter the insurance into the platform or through the experience, we're able to check eligibility right on the spot. So there is feedback going back to the patient to let them know, hey, by the way, you might have a Medicare Advantage card. So please go ahead and scan that insurance card versus your traditional Medicare card. And I think the most important part of all, when we're talking about automation, and something that really differentiates the different solutions that are in the market, is the whole concierge personalized experience that go to the patient. And what I mean by that is the concept of knowing who the patient is and only asking the relevant questions that are appropriate for that particular visit, versus having the patient go through an entire form, although it might be digital, over and over again. So Sherry, let me bring you here, because I imagine that as you are consulting in a lot of the different hospitals, you have identified that, of course, they're experiencing unprecedented staffing challenges. But have you seen organizations that have implemented automation, and what kind of lessons have you learned from these organizations that have gone down this path?
Organizations are implementing a variety of solutions. I think the big issue is that they're purchasing a variety of solutions from a variety of vendors. So this is increasing training time and overburdening the staff, requiring employees to log into multiple systems and work lists. It's extremely difficult to do the training, and then there isn't a cohesive platform to address the issues. So these employees are trying to solve the issues by working multiple work queues. It's still difficult. And really, the providers need one cohesive solution, one cohesive vendor that can offer all these solutions, so that they're not accessing all these different screens and different sign-ons.
Yeah, you're spot on there, Sherry. We see a lot of organizations that the staff members, unfortunately, are having to go into multiple systems, and they have multiple windows. It reminds me kind of like the Post-it notes around the screen that we used to have back in the day, right? So, but now it's with the screens in 2 monitors. So I can definitely echo what you are sharing. And I'm wondering, do you see organizations outsource this process? So instead of solving the challenge with technology, they might be leasing labor to augment their staffing challenges. So is this a viable solution, or a solution at all?
So we are seeing quite a few that are outsourcing some of these processes. The problem is that these vendors are also experiencing labor shortages. So they contract, and then the vendor isn't able to provide the service, or it's delayed, or they're behind. For example, in pre-registration, you need those pre-registrations done several days, if not a week, prior to that patient coming in. If the vendor doesn't have staff to complete that process, it's not helping you. You're in the same situation, and now you're paying for that solution. So that's what we're seeing with the vendors. They're in the same staffing shortages that we have, and don't have the innovation and the automation.
Yeah, that makes a lot of sense. So as we talk about pre-registration as the first kind of like step in the process when we're talking about automation, let's move on now to talk about authorizations. So when we're talking about what we see in the market, or what we have seen with practices that are trying to automate, is that they are manually checking payer requirements. So we're dealing in an industry in which we have a lot of complexity, and requirements change on a daily basis by payer. It will be ideal if you had Blue Cross and United Healthcare change their rules at the same time. So you wouldn't have to verify this information with 2 different payers at different times, right? But the reality is that that is not the case. So it's a very complex environment with always changing regulations. And because of that, the end users are forced to work with multiple portals and to provide this information in a variety of ways, whether it's because they're entering the information manually into a portal direct to the insurance website, they are using faxes, or they are making phone calls. So it's a very labor-intensive process, and it's one of those things that I have been tracking for years, and I somewhat decide to laugh versus cry, because we have had this problem for many, many, many years, and yet we don't have solutions yet until now automation is in place. So is something that is also affecting patient care. And the reason why I say that is because patient care is being dependent upon the staff's bandwidth to complete the work. In some instances, organizations go ahead and see the patients without the authorization, which is great from a patient perspective because they are not delaying the care, but it's terrible from a revenue perspective because now the organization has a risk of not getting paid for that service. So then we have high administrative costs and denial rates. So that's kind of like what you see normally still in a lot of organizations. But automation has really facilitated this process. And what I mean by that is the concept of automating the authorization predetermination and kind of like what we call sometimes a work queue cleanup. 25% of the time, staff members are just cleaning up a queue. And what I mean by that is the concept of having to go into a website and verifying whether or not an authorization is required to begin with. So automating this process has really facilitated, 1, the process, and 2, the free up of the staff members. Then talking about instant fax and web submissions to get instant approvals. So the concept of extracting the information from the EHR called the procedure code, the diagnosis code, the location, the provider, and then automatically entering this information, whether it's in a form that needs to be faxed or in a portal to obtain the information, which then, if all of this is done timely, is expediting patient care, not only because these mundane tasks are being automated, but also because now staff members are freed up to deal with the more complex submissions that sometimes they don't get to. And then that, of course, improves operational and financial outcomes. So I definitely see a lot of benefit and opportunity on the automation side on the authorization side. Cherie, let me ask you a couple of things. I have seen that, of course, organizations are not only able to reduce denials, but also write-offs. We have had an organization within our partners that decreased write-offs by 55% within the first 3 months after automating this process. And it was not only because the instant approval submission were being automated, but also because what I was mentioning before, they could now concentrate on other authorization requests that require their attention and expertise. And unfortunately, I have seen many organizations miss this opportunity because a lot of solutions out there are requiring a very strict path to be able to make this work, right? So they need to have the procedure code in this field, the diagnosis code in this field, the location, the provider for this automation to work. And the reality is that I don't know that I have come across an organization that is so structured, right? Every single provider has a different way of documenting the information. Some of them use a description, for example, the X-ray of the left leg, and then another provider might say the left leg needs an X-ray, or they might enter the procedure code. So what have you seen with your clients, Cherie, in regards to this standardization, and when they're trying to automate, what are they trying to do?
Yes, it really highlights the supporting options to extract this information from the original documents. Patient access staff, they're not skilled at ICD-10 or procedure codes. So we really need to extract the information from the document that the physician created from the order to really drive that. In addition, organizations, need to have, consistent methodology of communicating. so that these crosswalks can be developed. It's been when I worked at other organizations, every hospital had a different methodology, whether it was the name or the numeric. And so we really need to drive the industry to use the order and use the ICD-10 codes along with the procedure codes and really drive that so this process can be automated.
Absolutely. And I will say in the meantime, allowing flexibility within the configuration of the bots to help organizations get these crosswalks is going to be key to the success of automating the workflow. I would hate organizations to miss the opportunity to do that because they are not as structured as needed for other solutions in the market. Very good. So let's move on to the last piece of this particular evolution of the financial clearance process, and let's talk about price transparency in regards to patients. So, of course, things that we see with different organizations or that before they implement automation has to do with patients receiving payment details after the care is delivered. So it's a very reactive process in which out-of-pocket expenses are not transparent to the patient. And they are somewhat surprised at the end after the services have been rendered as to how much this is really costing them. So definitely not an ideal experience for the patient. And then the other thing that I have seen is staff are calculating estimates through spreadsheets. I've always said something is better than nothing, but there's definitely better ways to accomplish or to complete the estimations themselves. And then there is a limitation of the amount of options that are available for payments. So we're talking about organizations that perhaps are just offering check, cash, or credit card, right? That's all that is being offered as a method of payment, which is not really meeting the patients where they are. And there is a high cost to collect. And the reality is that there's two things. One, once the patient leaves the organization, the likelihood of collecting from this patient is much lower. And number two is the concept that it costs four times more to collect from the patient than it is to collect from an insurance company. There are multiple statements that are going out, there are multiple phone calls, collection letters, then you're sending them to a collection agency, and then there is a 30% collection agency fee. So it's just a really costly a process when we are not actively collecting from them prior to the appointment or at least at the time of service. So here's where automation comes into play and really supports the transparency that not only the government is requiring, but also that patients strive for or desired. One is to proactively notify them of what they are going to owe. I think as a consumer, I cannot agree more with the concept of understanding what is it that is going to come out of my pocket when I'm receiving medical care. The second part is automating the estimate generation. So working with spreadsheets is something that can be automated and it can be displayed through the experience to patients. So it's a cohesive, integrated way of merging the two processes, the notification and the generation of the estimates themselves. And providing a variety of payment plans and payment methods. So not only the cash, the check, and the credit card, but some people are paying with Venmo, Apple Pay, right? And also the concept of helping the patient pay for these out-of-pocket expenses. So perhaps offering the payment plans. So having this particular experience, understand the patient to the point where they can say, you know what, this patient would benefit from a payment plan. Or, hey, by the way, let's go through our instant financial assistance process to identify whether or not you qualify for it. So it's not only notifying the patient of, hey, this is what you might owe, but help the patient pay for this particular balance, which then, of course, decreases that write-offs. So, Cherie, the No Surprises Act has really pushed organizations to actively provide estimates for all uninsured patients. Like I mentioned, I have seen a very manual processes to satisfy this requirement, from having a very printed copy next to their computers, kind of like a cheat sheet or the Post-it notes that we keep talking about, right, to using sophisticated spreadsheets, right? But I have two questions for you. One is, what have you seen at your client sites, right? And the second side is, have you seen organizations actively provide estimates for insured patients? So not only the ones that the government is requiring them to do on, but also others that would benefit for such a process.
Yes, I have. I have implemented a variety of self-pay solutions as well as insurance options with my clients to comply with the No Surprises Act, from highly complex to manual processes. The communication with the patient's manual requiring often multiple phone calls to the patient, and patients rarely pay on that initial call. So that requires patient access or the follow-up department to call multiple times and send multiple statement messages to the patient at a high cost in manpower and statement processing. My understanding that obviously Notable sends this information via text to their phone, eliminating all these phone calls and statement processing with significant savings to the patient. I think that is a huge improvement.
Absolutely, Cherie. And it's just, to me, is kind of like meeting the patients where they are. And providing a concierge remembered experience where they feel like, okay, the practice knows me. I've been going to this physician organization for many years. They know who I am. They know what I need. So it just really is a win-win for everybody. So let's talk about what to do next, right? So we're talking about kind of like the three steps to continue down this path of enhancing the patient financial clearance process. And the first one is start with the front end, okay? Evaluate all the processes that you have that are very labor intensive. So from an organization standpoint, you have an idea probably already as to where do you have the most FTEs. Then identify which processes will really benefit from automation. And we're looking to really speak to value. Where will you get the fastest return on investment? The second part, so once you understand where the challenges might be or where the opportunities might reside, is document kind of like a baseline key performance indicators. So understand your key metrics and the staff requirements for these labor-intensive processes. So time studies. I just came back from the HFMA RCM conference, and during the revenue cycle executive panel, they were talking about the concept of, okay, it's important from an organizational standpoint to understand, okay, here is the process as we understand it at a managerial level, but then do some shadowing to make sure that what we believe is happening is actually happening, right? A lot of times the process might vary or different things might occur depending on the staff members. So shadowing is going to be very important. And then time studies. How long is it taking to manually update demographics? How long is it taking to manually update the insurance information and check eligibility? So getting all these key metrics are going to be very important for you to understand what is that return of investment when you are automating processes. And of course, get ready to then, when you have all this information, to engage with possible partners. And then number 3, when we're talking about evaluating partners, finding a partner that can really customize their solution to meet the challenges of the organization. And through the resources link that we have here in the webinar, we're sharing with you the 6-point checklist to be able to guide you through this evaluation process. So with that, I don't know if we have any questions.
All right, thank you, Paola. Thank you, Cherie, great work. We have a few questions coming in, and the first question is, once health systems move to automation, what do the provider success rates look like?
So Rajiv, let me take this one. I can tell you that adoption of this type of technology is sitting at 53% in the first couple of weeks after it's being implemented. And we're seeing it as high as 70 to 80% adoption rates, meaning completion from the time the patient gets the text message all the way to completing the entire process of 70 to 80%. And that is like after a few 3 to 6 months of utilizing the solution, as well as patients getting comfortable with it.
Yep, thanks, Paola. Another question coming in: can the insurance card and identification be scanned by the patient to populate the registration?
Sure, I'll take that question. Insurance cards can be scanned along with the identification cards to populate the information directly into the provider's EMR or the financial system, virtually eliminating all of those keying areas and reducing those initial denial rates. That's why this is so innovative and why organizations today need to move to these new processes.
Awesome.
And I will add, Rajiv, if you don't mind, let me just add a couple items there.
Yeah, for sure.
Because I mean, Sherry's comment in regards of the importance of transitioning to this type of technology are quite key for the automation to provide the benefits. But I will push it one more, and it is not only extracting the information and entering this information into the EHR, but the accuracy of selecting the right plan based on the insurance information, right? So that's another thing that I imagine, Sherry, you see quite a bit with your organizations, is the fact that, yes, the insurance card has been obtained, the information is there, but now the staff member is deciding which one of the 10 Blue Crosses do I pick. So that is where a lot of the value also comes into play in the automation component is truly selecting the right plan to be able to send the claim.
Absolutely. That's great insight, Paola. Let's see, we have a few other questions. Okay, so this one, it looks like, is the automation intuitive and are patients using it?
Yes, and I will tie this to the first question, Rajiv, as well, in the sense that the big reasons as to why adoption is so high is because the solution itself is intuitive. It's easy for patients to go through the experience. Remember the experience where they're not having to enter information over and over again, where they just get frustrated at stop doing anything or completing the experience. So that's number one. Number two is the concept of really knowing when to send what. So for example, if we're talking about patients that are retired, sending the text message during the afternoon is okay. Sending it during lunchtime is great. They happen to be at home. They have the time to complete the experience at that time. But if you're going to do that with working parents, it's not going to work, right? So knowing that, for example, for working parents, you might want to send the experience after 6 o'clock, 7 o'clock in the afternoon, then they will take action. The likelihood of them taking action increases. So it's not only a very intuitive experience, but it's also a smart experience in the sense of knowing when to send it. So our conversion rates are actually higher.
Absolutely. No, that makes sense. And then a follow-up to that, for the patients that choose to not self-schedule or self-register, how do you manage those patients?
Sure, I will take that question. The goal is to teach the patient how to use the system one-on-one. If they come into the hospital and they did not self-register, then that's the time for the patient access staff to work with them, show them how to use the self-registration process via their phone, how easy it is, and really spend time with the patient. The one thing we don't want to do is we don't want to incentivize the patients at the time of registration and do it for them. That's not going to help the patient. That's not going to help the long term of the hospital, but really work with those patients one-on-one and show them how to use the system and self-register.
Awesome. Thanks, Sherry. And then we'll be able to get to one more question. And so it looks like this is around consents. So how are consents managed for patients?
So consent forms is something that gets extracted from the system. So we're able to identify, okay, what are the forms that you're utilizing today? When were the last time that they were signed? And do they need to be reevaluated? So that information is extracted from the system, is then displayed to the patient to let them know, hey, by the way, you have signed this particular consent. You signed them in this date. But we have another consent that needs to be signed right now. So then they're prompted to review the PDF file, and then you can get the e-signature. Once that occurs, that's very important, but even more important is to get this information back into the system. So we're eliminating that manual process. So what happens is the patient reviews the information, signs the consent, and then the digital assistants are uploading that signed consent into the appropriate folder in the EHR. So it's definitely closing the loop for the staff member.
Awesome. Thanks, Paola. All right. So with that, I'm going to close out the presentation for today. If we didn't get to your question, we'll be sure to follow up with you after the call. But I'd like to thank all of our attendees for joining and to our wonderful speakers, Paola and Cherie. And with that, thanks again, and we'll talk to you soon. Have a great day.